I'm Colleen Houston.
I'm Brad Robertson. We're with the Disability Action Hall.
And we're here to tell you about how's the Alberta government doing.
I think it's doing good, but could be doing better in other ways, and things need to improve.
So our first challenge has been social assistance reform, and that meant indexing age to the cost of living and exploring basic income.
Yes. We need to have cost of living adjustments every year for people on age and on social assistance.
Our next challenge is labor standards. So minimum wage has been increased in September, and many of the disability service sector cannot afford to pay overnight staff minimum wage, and that leaves people unsafe. And we had a huge victory around the safety standards. We got rid of those last year, but now minimum wage is now a threat to people's safety.
Yes, it is. And we need to have a guaranteed minimum wage increase, and we need to have these people safe.
So the Lobbyist Act review is another challenge. It's under a committee right now, but the recommendation is to include nonprofits as lobbyists, and we're not lobbyists.
No.
We are people with lived experience who need to share their wisdom and don't wish to be gagged by legislation having to do a registry and track our time and all that paperwork. Who needs that?
Nobody really.
Human services.
Human services need to improve. We need to have better staff and better wages for our staff.
Healthcare.
Healthcare, we need to be able to get better answers out of the medical profession and have more timely access to specialists and services that especially disabled people need.
One, changes to the Marriage Act. No longer needing a doctor's note to get married.
Yes, that was a very good thing that we did, and I'm very pleased that we did it, and I'm glad they changed the Marriage Act.
Another good change that the previous government made and this government has fixed is progressive taxation.
Yes, we needed to change that. I don't think a flat rate taxation worked. We need to have progressive taxation, and we got it changed.
Getting older, aging from human services to the seniors ministry.
That should not have happened with age people, because at 65, your disability does not end. It gets, for some people, progressively worse, and they need that age money, and they need to continue of their age benefits to provide for their medical needs. And I think it's not acceptable that that's done. And I think it needs to change back that you stay on age until you pass away.
Yeah, just because you turn 65 doesn't mean you're no longer disabled. So we're big supporters of basic income, provided that supports and services remain intact, including health benefits that are connected to age.
Yeah.
Lastly, accessible, affordable, available housing.
Affordable, accessible housing needs to be more available. There needs to be more of it, and we need to have it now. And overall, the government is doing quite well. They need to have a better continuum of action to seniors' benefits, and they need to do more on housing. That's our update, and you guys have a good conference. Thank you.
Thank you. Have a great conference. You can reach us at www.actionhall.ca to learn more about our initiatives. Thank you for letting us join you virtually.
Thank you.